Following the suspension of 16 aid agencies in the north of Sudan, UNICEF is still in the country working to meet the needs of women and children. The removal of these agencies means that life-saving services for an estimated 1.5 million people have been interrupted. This is having the greatest impact on children in Darfur, who are being denied crucial services such as clean water, food and healthcare. Susan Lillicrap, nutrition specialist at UNICEF Sudan, was in the UK recently. I asked her to describe the current situation in the country with regards to the expulsion of the aid agencies.
Those 16 aid agencies were actually doing quite a lot of the work. Everyone always says 16 out of hundreds. Well, there were 16 of the biggest agencies, the ones that were doing most of the work. Also the specialists in many of their fields, like Oxfam for water, Action Control Reform, that were specialists in nutrition. So we've lost some of the real specialist agencies. So what's the situation at the moment on the ground? Everyone's trying to desperately cover for those needs, trying to keep the water flowing, keep the clinics running, keep the feeding centres actually working, but it's a struggle. Finding ways to fill those gaps that have been left. They're fairly significant gaps. We've had to take on much of the activities that were done by the aid agencies, like in nutrition. There's 35 centres that are not being run by aid agencies, and UNICEF has been trying to continue those services, because if those services stop, the children will die. If those camps don't have water, the children and all of the people will suffer. They'll get more diseases, and then there will be even bigger crisis in Darfur.
What does UNICEF need in order to continue meeting the needs of children?
This is putting a long, big strain on the funding. These 16 aid agencies used to bring in their own funding. At the moment, UNICEF is now providing the gaps in mostly nutrition and water, but also after the initial crisis, we're going to have to be looking at funding all of the education work that used to be done by Save the Children and the others. So we're having to fill those gaps, and that unfortunately takes money to be able to continue those services at the same level. The talk was about 20 million, so an extra 20 million to pay the staff salaries, to provide the drugs and the food that was being provided by those agencies, and all of the water equipment.
Aside from the expulsions, what is the situation like at the moment in Darfur?
Situation in Darfur is poor. The security is getting worse. So the ability to access a lot of the communities are making it very difficult to work in these areas. So that interrupts the provision of all services. So the whole harvest, etc., in the whole of Sudan has been taking a big impact on children. The price food increases have also put a great strain on all of the Sudan who are having to buy food at greatly increased prices. So there's lots of children who are at risk of malnutrition or in being malnourished. UNICEF's nutrition program has really two parts. One is the emergency, treating the children who are severely malnourished and 9 times more likely to die. Also the moderate malnutrition. So that normally would be providing training for agencies working in the government, providing that care, providing the therapeutic foods that we need to feed these children, and monitoring the situation to make sure that we're there ready to be able to respond in the right areas before it becomes a crisis situation. So the second part is the more developmental side of the program, looking at trying to prevent malnutrition, so making sure things like vitamin A is given to all children, and working with breastfeeding promotion, because that's very poor in Sudan, and that has a huge impact on improving the lives of the child. If they're actually breastfed, they're more likely to survive.
If we can get beyond the immediate emergency, what are UNICEF's plans for the future?
If we continue just working on the emergency nutrition problems, we're going to keep having to do that forevermore. So we have to really focus more attention on the preventative aspects of our programs, making sure that all of the health workers in the country are trained on nutrition, understand nutrition, and are able to actually implement those programs sustainably, that they it isn't just a training, that they actually do it every day. If a child is exclusively breastfed for 6 months and gets good complementary food, the appropriate complementary food, we can save 20% of those children die. So that's a huge impact. If a child has iodized salt during pregnancy and when they're growing up, they're going to be brighter, cleverer. A malnourished child is not going to ever reach its full potential. So if you actually make sure a child is well fed from, during the pregnancy period and then all the way through its first 2 years of life, we're going to get much brighter children that have got much more potential to fulfill the development needs of the country.
UNICEF needs more funds to be able to continue meeting the needs of children in Sudan. You can make a donation now at www.unicef.org.uk/Sudan. This is Andy Brown reporting for UNICEF UK.